Good morning. Welcome back to Practically Social. I'm Zachary George, your host today, and I am in downtown Grand Haven, Michigan today, a classic old town. And I wanted to welcome you, show you the sun this morning on this beautiful main street, a little courthouse. Safety plans are a way to offer people struggling from mental health and addictions crises a plan to get them to safe harbor. Think of them as a lighthouse that guides them until they can escape stormy and dangerous conditions. Lighthouses have assisted navigators around the world since ancient times to avoid rocks, reefs, and sinking. Safety plans assist us in the same way, both as clients and as mental health professionals. Safety plans also operate as a map and a series of steps that anyone can take in order or separately. They're written in plain text on paper and kept in convenient locations such as in a purse, on the fridge, or bedside table. Safety plans are meant to be shared with trusted friends, family, and also with health providers who can keep one in your chart to go through with you or reprint it if needed. In my practice throughout the years, safety plans have been created with clients for suicidal thoughts or triggers to use substances or in a mental health or substance use crisis. However, they've also been demonstrated for effectiveness to address abusive relationships, self-harm such as cutting or burning oneself, and other concerns. The best time to create a safety plan is before crisis strikes. Safety plan use has been shown to reduce isolation, increase survivability, and build relationships more strongly. They're associated with gains in well-being and in helping to prevent suicide and relapses. Constructing a safety plan is a short, easy, and relieving process. Let's start with what a safety plan should contain. Though there is no set standard for how a safety plan must look, I recommend the following be included. Number 1. A list of things that you like to do to distract yourself from thoughts and feelings that are bothering you. What are your hobbies? Do you like to listen to music or take a hot shower? Do you play video games, watch movies or shows, or do something with your hands? What are those activities you like to do? Write them down and think of as many as you can with a minimum of 3. Number 2. Where are some safe places you can go? A friend's house? To a drop-in center or a meeting? To a close family member's, co-workers, or someone you're dating's house? If you don't have anywhere you consider safe, work through this with a therapist to generate ideas. Number 3. Who can you call and talk with? There should be someone understanding, and it doesn't have to be someone necessarily close to you. List their names and their phone numbers. Again, try for at least 3 people. This list may include your therapist, crisis line, sponsor, or fellow group member, a member of a spiritual organization, or family and friends. Be ready to leave those folks your voicemail or text if they don't answer. And you have more than one person to call, so in case someone doesn't answer, someone else will. I recommend calling because it can be seen or heard faster than a text. Once again, I recommend calling. What are your emergency phone numbers? Number 4. What are your emergency phone numbers if you're thinking about planning to harm yourself, kill yourself, or use substances? This list should include 2 numbers at a minimum: 911 or local emergency number, the Suicide and Crisis Lifeline, also in Spanish, which is 988 and available 24 hours a day, your therapist's number, and the number of immediate family or persons close to you who can provide emergency help, such as sitting with you or transportation to a hospital. Number 5. Lethal means reduction. Suicide risk is increased for those who have access to lethal means such as firearms, sharp objects, vehicles, ligatures such as rope or things to strangulate themselves, medications, alcohol, and other substances. If you have firearms, who can take them until you feel safe again? Are they at least locked up with ammunition separate? Can they be disassembled or locked where you don't have access? Can someone take your ammunition and store it away from your home somewhere else if you don't want to give them your firearms? Who has access to your safe or gun cabinet, and can they assist you in securing your firearms elsewhere? This doesn't mean you won't get them back. It's a precaution when you're in danger. We're lowering the risk this way. With sharp objects, can access be limited or can someone remove them? Who is the person who can do that? With vehicles, can someone else drive you temporarily, or can you take public transportation, use Uber or Lyft, or ask for rides? Who will hold your keys? We follow the same process with ligatures, medications, and substances. With medications in particular, can someone give you only a day's supply at a time, or assist you when you take them? Quantity should be secured in a safe location, and this includes other medications in the household as well. Alcohol and other substances increase risk of suicide and substance use. Avoid them and ask a trusted person to help you remove them from your environment. If you aren't in a location free of substances and you worry about relapse or suicide, plan with trusted people to stay in a safer environment for the time being. Therapists, caseworkers, and sponsors or friends can help you find resources. Try calling 211 and asking where you might be able to stay in a sober environment as well. Number 6. Who or what do you consider worth living for or staying away from substances for? Many people have listed their pets, their children, their significant others, music, art, and events they have coming up on this list. Again, look for 3 things to list wherever possible as a start. Finally, once you have written these down, go over the list again with your therapist, sponsor, close friends, and others who you think will help. Keep the list in a convenient location and tell others where your list is. When you feel a crisis coming or are unsure if you're safe, use your list like a lighthouse and a map to guide you out of crisis. This is why safety plans are important, because when we're in crisis, we are in feelings. Having something close by and written down already, a plan, is critical to our survival and well-being in these situations. Use your safety plan whenever you feel challenged. You don't have to wait for the worst of your feelings either. Safety plans are effective means of harm reduction and suicide prevention. Research has shown they're effective when they're used and when healthcare providers have access to them to review with clients. If you have further questions about safety plans, reach out to your mental health professional for guidance. I hope you found this video helpful. If you learned something, have questions or comments, please hit the like button, save the video for further reference, and subscribe and share to any of my over 40 videos I have created on mental health, addictions, social issues, and self-help. Your participation is essential to my work, and I look forward to speaking with you again on the next Practically Social.